And I have a daughter who lives in Minnesota. She's in her senior year at the university there. She still can't get a vaccination, and she wants to get the vaccination. That's not the situation we have here. Here, walk-in vaccinations continue at the Wisconsin Center and at our community sites at North and South Division High School for residents 16 and older. So unlike some parts of the country where you can't get the shot, you can get the shot here in Milwaukee. You can absolutely get the shot here. The other point that I want to make is that receiving a vaccine is free, it's quick and easy. Just the other day, I was talking to someone who was talking about California, and the person she was referring to had to pay for the vaccination there, had to pay for the testing there. Receiving a vaccine here, again, I want to repeat this, is free, quick, and easy. If you're going to receive your vaccine this week or next, don't go alone. Consider bringing a family friend, a family member, a friend, or a neighbor with you. Let's get more people out there to do it. So please help us in our vaccination efforts by spreading the word to people you know. Talk with loved ones and neighbors about your experience receiving a vaccine and about why you chose to get vaccinated. Connect with them with information or resources so they can make an informed choice. Again, just in the last couple of days, I was talking to someone who was at a church event, and there were a significant number of people there who were not interested in getting the shot. But after hearing from Dr. Tito Izzard and why it was important to get the shot, there was a significant number of people who changed their mind and got the shot. They made an informed choice. They got the information they needed, and they got it. So these authentic stories are so important in guiding decision making. And that's why I'm so pleased that Mara Lord from the Medical College of Wisconsin is joining us for our briefing today. Mara has been leading the Authentic Voices campaign to share real stories from our community and the motivations behind why our residents are getting vaccinated. And you'll hear more from her shortly. A reminder as it pertains to the vaccination sites, Monday, April 19th, so just 5 days from now, roughly, our new community vaccination sites will begin at the Northwest Health Center at 76 in Mill Road and at the Southside Health Center at 23rd and Lapham. The North and South Division High School vaccination locations will conclude at the end of this week for the simple reason that the schools are reopening. And we're going to put those back into operation, or the Milwaukee Public Schools is going to put them back into operation for the young people in our community. So that's great news, that the young people get an opportunity if they choose to attend in-person learning. But that's why North and South Division High Schools will no longer be vaccination sites next week. But again, on the northwest side at 76 Mill Road and on the south side at 23rd and Lapham, we'll continue to have a strong presence. The hours for these new community locations will be Monday, Wednesday, and Friday from 10 a.m. to 4 p.m. And some additional later hours on Tuesday and Thursday from noon to 6 p.m. And again, no appointment is necessary. Testing hasn't gone away. And so finally, I'd like to touch on our gating metrics for this week. We are in the high transmission category for the number of COVID-19 cases per 100,000. That's up from last week when we were in the substantial transmission category. For that reason, we really need to double down on our mitigation and vaccination efforts to stop these rising numbers. As I've stressed, vaccinations are very important right now, but so is continued testing for anyone who feels symptomatic or thinks they may have been exposed to someone who has tested positive for COVID-19. And also important are our everyday measures like continuing to wear a mask, wash our hands, and watch our distance. Each of these efforts is a layer of protection against the virus and helps us keep our community safe. So please remain committed to helping us fight COVID-19. And with that, we'll turn it over to Dr. Weston, I believe.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we are currently seeing an average of 137 new cases a day and about 1 death each day. Our gradual but sustained increases in cases, percent positivity, and hospitalizations continue. We've seen a definitive decline in vaccinations being administered on a daily basis from over 9,000 per day a week ago to less than 8,000 currently. We know that there is substantial vaccine availability in the community, so we need to continue to remove barriers to vaccination and encourage, educate, and message on the benefits of vaccination. While the EVE model does demonstrate progress in our vulnerable communities' vaccination rates, we still have a long way to go. And we did add a new and important view today to our public-facing Milwaukee County COVID dashboard. It's under the Municipality Trends tab, where you can now see each municipality's individual vaccination rates over time to better understand how vaccine administration and uptake is going in your community. So I want to talk for a minute today about what is often called vaccine hesitancy. There's a lot of ways to break down the degree to which someone wants or doesn't want to get the COVID vaccine. There are people like myself who jumped at the chance to get the vaccine. I would have taken time off of work. I would have traveled as far as necessary to get the proven protection that the vaccine, any of the vaccines, offers. On the other hand, on the other extreme, there's a small but impactful group that absolutely will not get the vaccine no matter what. But then there's a significant and shrinking, but significant group in the middle. And I'm sure many of you watching this fall into that category. Perhaps you're willing to get the vaccine, but you haven't taken the time to actually go out and get it. It may not be high on your priority list, or it may be difficult for you to do due to work, childcare, or transportation. And I can understand that. My life over the past year has been fairly consumed by COVID. My work has been consumed with COVID, both through this work, helping with the coordination of the response, and through my work in the emergency department, seeing patients that are suffering and dying from this disease. And based on my experiences, I jumped at the chance to get vaccinated. But that's not the same experience for everyone. The vaccine is, and I get this, not a high priority for everyone. But if you're willing to get it, now is the time to do so. And it really couldn't be easier. There are literally hundreds of vaccine sites in Milwaukee County. There are walk-in sites like North and South Division High School, as well as now at the Wisconsin Center. There's sites with same-day appointments like the county site at Kosciuszko Community Center. There are transportation options that are often available through your local health departments. Now, you may also be in the wait and see group, on the fence as to whether the vaccine is safe, whether it's effective. And I can understand that as well. In January, when I received my vaccine, they were new. They had undergone scientific trials with tens of thousands of people, but they hadn't been given on a massive scale to millions of people. But that has now changed. Nearly 200 million doses of vaccine have been given just in the United States alone. Over 100 million doses of Pfizer and 86 million doses of Moderna. Now, when that many people are vaccinated, safety issues come to the surface. And with these vaccines, they've been found to be incredibly safe. Johnson & Johnson is a bit newer, and the system worked exactly as it should. About 7 million, far fewer than Pfizer and Moderna, but 7 million people have been vaccinated with Johnson & Johnson. And as can happen, extremely rare, literally 1 in a million, possibly related adverse effect of a rare type of blood clot was discovered and is being carefully reviewed. But for those who are waiting and seeing, we're 200 million doses in to these vaccines in the United States. They've been proven. They are safe, and they're incredibly effective. So whether you're in the group that's willing to get the vaccine but has not made it a priority, or the group that's waiting and seeing, please don't be the person that gets sick with COVID, that gets hospitalized with COVID, as we're seeing more, and especially now in younger people with the new variants, or the person who dies with COVID when there's a vaccine here. It's here, it's available, and it's effective. In a few minutes, Mara Lord will discuss a vital initiative to reach these folks who are on the fence. Mara and other partners have reached out to our communities and found real people, authentic voices to discuss why they chose to be vaccinated. They chose to be vaccinated to protect themselves, to protect their families, or to protect their children who can't yet get the vaccine, and to protect their communities. So if you have not already done so, I hope that you make the same choice. Thank you, stay safe, and I'll hand it to Director Roush.
Thank you very much, Dr. Weston. It's my pleasure to join today to provide a little bit more of an update from the epidemiology data related to COVID-19. Before we get started, I'll just talk about a few overarching themes we're seeing in the data this week. Again, as Dr. Weston mentioned, we continue to see a sustained gradual increase in cases throughout the county. And while the slight increases are seen both in the suburban communities and the city of Milwaukee, the increase overall is a bit more pronounced in the city of Milwaukee. Additionally, when we look at children 18 years of age and younger, we see that their trends upward have been more significant than the population as a whole. And specifically, that increase is more pronounced again in the city of Milwaukee, but the current 7-day averages comparing the city of Milwaukee children to the suburban children are approximately the same. And these increases are not just Milwaukee County specific only. We're seeing these increases across the state and the region. The state is currently reporting 7-day averages of approximately 850 cases statewide, which is a mark that we haven't experienced as a state since mid-February. And most importantly, the increasing case numbers and that gradual increase continues to underscore the importance of doing all of the things we can do to keep ourselves safe, the 3 W's, and get vaccinated. And I'm happy to say that much of our media briefing today is about the importance of vaccination and providing information and resources for all who still need to get vaccinated in our community. So with that said, I'm going to switch to sharing the data at this point and hit some of the highlights that we are seeing. So what's before you here on the screen is data related to new cases of COVID-19 throughout Milwaukee County. And again, you can see since just before the middle of March, probably around March 10th or so, we've seen some pretty steady increases in both the city data, 7-day average in the orange line, and the suburban communities in the blue line. When we switch to the kids report, which is now on the screen, you see that those increases are a bit more pronounced. Certainly in the city of Milwaukee, that increase was pretty significant, a little bit of a tail off, and now a little bit more of a plateau to a slight increase, and the suburban community rise is a little bit more gradual. In the kid report, we report those increases, but we also are now reporting, so that you know, hospitalization data. So anybody who gets this report and is looking at it here on the screen, we are looking at a hospitalization graph of Milwaukee County children 18 and under throughout the duration of the pandemic. And what we see is a lot of the similar trends we see in the general population, a huge spike in November when we were having lots of cases. But notably, again, we're seeing more cases and more cases hospitalized in younger age groups than we had seen previously. Largely, this is probably due to high vaccination rates in our older, more vulnerable individuals, but it's certainly something to note as we watch this increase over the last few weeks. The risk of COVID, as we have seen in the past, increases with increasing age, starting at about 2 years old and moving up through age 18. And that probably reflects more of the activities and autonomy and additional potential for exposure that our kids under the age of 18 face. We have in the kids report a number of data tables. This data table talks about hospitalizations. We see that the mean age is about 9.5. And we see that the majority of our children who are hospitalized fall in the 0 to 4 year category. It's about a third of all of our hospitalizations for kids are between the ages of 0 and 4, and 25% of our hospitalizations are occurring in kids between the ages of 15 and 17. So there is hospitalization occurring and at pretty considerable rates considering. We've talked before that disparities related to COVID and COVID hospitalization exist. And as we see here, nearly half of the Black or African American children are being hospitalized, and about 30% or just under a third of our Hispanic Latinx kids are being hospitalized. So those patterns are certainly important. Lastly, I want to show kind of the spatial pattern of where cases are occurring in our kids throughout the pandemic. And you can see here when we look at March of last year through April of this year, over the last 13 months, we see a lot of cases throughout the community. Pretty good scattering throughout the community. The more red or orange areas are where we had more cases and more disease activity. When we drill down over the last 2 weeks, we see some differences. We see largely more activity in the southern suburbs, more activity in some of the northeastern suburbs, as well as the west suburbs, but there's still some activity throughout the county. And so we want to watch that very carefully because kids have been very contributory to the increased rise in COVID cases, but certainly we are seeing increases in COVID across the population as well. So with that said, I'm now switched back to the whole county report. As Dr. Weston has mentioned, we're averaging 1 or less deaths per day, which is very good news, and it means that our most vulnerable populations have and continue to be vaccinated at a very high level. Our transmission rate is kind of alarming, and that's something that I want to flag for you all today. We've talked about the reproductive number in the past, and we want that number to be below 1. And unfortunately, since about mid-March, we have had a transmission rate over 1, meaning that there's going to be more and more cases of disease. So again, we need to push that transmission rate down. We can drill down on that data by looking at the city of Milwaukee on the top and the suburban communities on the bottom. And again, similar trends, but what we see here is that the transmission rate in the city of Milwaukee is increasing while the suburban rate, at least at this point, is currently decreasing. We've talked about testing. Yes, there's lots of testing available. We're seeing that our testing availability is still very high, and our testing rate is still quite high, certainly down from where we were. We're seeing certainly things trending in the wrong direction related to testing, like percent positivity, and we're seeing very flat to slightly increasing trends in positive cases throughout the county. Lastly, today we'll look at the spatial pattern of COVID over the pandemic, which is this map right here. And again, lots of activity throughout the county over the last 13 months. And then when we focus a little bit more over the last 2 weeks, we see something very similar. We see a lot of activity throughout our communities. This certainly looks similar in some ways to the children report, with a lot of activity in the southern suburbs and in the northern and western suburbs, but a lot of disease activity really throughout the city of Milwaukee here as well. So in some cases, we know that children may be bringing disease back into the family, but in other cases, older family members may be bringing COVID disease into the family, and kids are a secondary generation of COVID. So we need to continue to watch this data. We need to continue to do all the important things that we need to do to keep ourselves safe. Lastly, today I want to end by talking about vaccine availability, a theme that we've heard already. And I also want to talk about the most recent Wisconsin Supreme Court ruling. Again, as many of you know, when you see me on these briefings, I've said for many weeks, eligibility does not mean availability or does not equal availability. But certainly you've heard Mayor Barrett and Dr. Weston and others talk about how we have a lot of vaccine in comparison to what we've had in the past. And there's a lot of vaccine availability here in Milwaukee and throughout Milwaukee County. So that means there's lots of locations that you can access. There's health department locations like here in the Greenfield Health Department. There's clinics and pharmacies and the FEMA site at the Wisconsin Center, some other sites that the city of Milwaukee is putting up throughout the community. There is availability, and this availability exists even with the absence of the Johnson & Johnson vaccine currently. So if you need to be vaccinated, please seek out that vaccination. If you need to learn more about the vaccine, again, reach out to friends and colleagues and others that have been vaccinated. Reach out to your medical professionals and other trusted individuals in your life and ask them why they got vaccinated. Because one of the most important things you can do is get vaccinated to protect yourself, your family, your coworkers, your friends, and your community. Many clinics are offering vaccines by appointment, but many are also offering vaccines by walk-in. So that appointment barrier no longer exists as well at many of your clinics, and carefully consider that as an option for your vaccination needs. Secondly, and lastly, I want to address the Supreme Court ruling from earlier this week. As many of you know, earlier this week, the Wisconsin Supreme Court overturned Governor Evers' orders from last spring and summer related to capacity limits in bars and restaurants. Specifically, this ruling referenced the power of the governor, and specifically the power of the governor to issue orders that didn't go through a rulemaking process. And so basically the Supreme Court struck down the order because it didn't go through the process that was outlined in statute in their decision. This court ruling is important, but certainly does not change the ability of local health officers to issue local orders throughout the state. And in many areas of the state, local orders on capacity and local recommendations on capacity still exist. As a public health official, though, I do want to comment about the continued proposed degradation of public health authority at the local level. And while our authority still remains at the local level, my colleagues and I are continually worried about further attacks on our statutory powers to prevent, suppress, and control communicable diseases in our communities. It's important for me to call this out because it is through these statutory powers granted to us by the state constitution to control communicable disease, and to control communicable disease in ways that many may not see day in and day out. For example, to control tuberculosis or TB disease in our communities, in our workplaces, at local universities, to control measles in a local daycare or school, to control the spread of E. coli, a dangerous pathogen, from contaminated well water, and to control the spread of foodborne illness connected to a local restaurant, grocery store, or caterer. These are just a few examples where local health department authority come into play that I, as a health officer here for the city of Greenfield, have engaged in during my time here, or my colleagues throughout the region have engaged in. Some of these may have been well known and played out in the media. Other of these happened behind the scenes to keep you and other members of the community safe. And so in conclusion, we can't simply ignore that we need local public health authority, and that authority needs to be preserved despite some bills that are pending in the legislature. Ignoring local public health authority would have significant and detrimental effects on the communities we serve and the state as a whole. So thank you for your time and attention. I'll now turn the briefing over to Mara Lord from the Medical College of Wisconsin to talk about an exciting new campaign titled Authentic Voices.
Thank you so much, Darren. Appreciate the opportunity here. So much of this briefing has been on vaccine, and our goal, and the reason I'm here today, is to talk about building vaccine confidence. So Dr. Weston talked about vaccine hesitancy, and we know that that exists, and we have been tracking data on a national level, and now we're really digging into local data as well to understand what those levels of hesitancy are across various communities. And so we have led a number of focus groups that with individuals who have originally said, I am hesitant or I'm not intending to take the vaccine. And we've asked people, what is it that would motivate you to take the vaccine? What is it that's causing that hesitancy? How do we reach you? And those focus groups that were led by Jump at the Sun consultants and Lorraine Lathan's group just have been so informative for us. And now we're moving toward gathering vaccine intent data across communities and across these targeted zip codes in particular to understand vaccine intent on a weekly basis. What I want to share with you, and I know that Darren introduced me as being from the Medical College of Wisconsin, which is certainly the role that I play on a daily basis, but I'm really here as the chair of the Vaccine Integrated Communications Outreach and Community Mobilization Group. And that's a group, a coalition of leaders and individuals and talent from across our community who represent many different sectors and many different organizations. We are loaned talent from across the community, and it has absolutely been our goal to build vaccine confidence by honoring that taking the COVID-19 vaccine is a personal choice. And our strategies have included listening to people's perspectives and experiences, and I mentioned focus groups, reflecting authentic voices, which we'll share, and authentic voices of our community, and making equity an imperative. And I just wanted to speak to equity for a moment. You've heard many times, I think, through these events and certainly through interviews over the past several months that equity around vaccine is critical. And I want to emphasize that not only is it equity in distribution of vaccine and access to the vaccine, but it's also a commitment to ensuring that our partners and our vendors and the members of our community who are engaged in all of this work receive equitable compensation and attribution. And we believe that making choices through an equity lens at every level of the work that we're doing will contribute to a stronger, more united community and build on the trust and respect even after the pandemic. So I say all of that as a preface because I think it's so important and we believe in it so strongly, and we've been able to practice that. And so what we're going to show you today is the campaign that we've brought together that's based on voices of our community, real voices, real choices. That's what this is about. Real voices from across Milwaukee and people who have their own personal choice in the matter. I wanted to just lift up some of the many different partners that have been engaged in this work. So Hanson Dodge Creative has led the creative strategy for the work that you'll see. Tyshun Wardlaw, videographer in Power. Aziz will share some pieces with us shortly. Jump at the Sun, Samar Ghani, Amanda Evans Photography, Karen Oliva Photography, Power Forward Media, Ryan Reeve, and many. So those are the vendors that we've engaged. And many partners are making this possible through philanthropy, through in-kind support, and like I said, through loan talent. So the purpose again is to build vaccine confidence, using and leveraging and lifting up people in our own community who may have been hesitant about the vaccine, who have chosen to take the vaccine, and sharing their very own stories of resilience and their stories of taking the vaccine and their experiences. In the beginning of this, Mayor Barrett mentioned that one of the best tools that we can use is our own voice. For anyone who's chosen to get vaccinated, find a couple of people that you can talk to about your very own experience. And this is what you're going to see in this campaign. I'll tell you before we turn it over to Aziz and then to Ms. Laura Manriquez, we are lifting this on television, radio, billboards, and in social media. And this is just the beginning. After this, we are continuing to capture voices from across Milwaukee on people telling us what's their why are they taking the vaccine, and then also what are they excited to get back to. We all know that people want to get back to who and what they love, and so hearing that from Milwaukee members as well. So Aziz, do you mind sharing the just a couple of samples of real voices, real choices?
Yep, I'm gonna share right now. Are you guys able to see my screen?
We are.
Okay. Perfect. Okay, I just also wanted to elevate that I'll show two 15-second videos, but all of the content and the wonderful work that has gone into this across the board that Mara talked about can be found on Healthy MKE. We have a slider on the home page, and when you click on Learn More, you'll be able to essentially explore, share any of the assets that really inspire or motivate you. I did switch tabs. Can you guys now see the video screen? Just wanted to make sure. Perfect. All right, so I'll share this first one, which is from Miss Gwen Washington, a personal advocate and friend who I've known for many years, and just want to give her a quick plug. She's one of my favorite people, so I'll share this.
Meet Gwen. At 19, she took over the care of her sister's children. Then she cared for all kids through the Milwaukee Teachers Union. Now she's caring for her community with this. Will you show your care? Learn more about COVID vaccines at healthymke.com.
Was the sound okay on that? I can see you, Catherine, tomorrow. Okay. And now, right before she speaks, I will share Miss Laura Manriquez.
Meet Laura, a nurse who overcame a traumatic brain injury, now studying to become a healthcare administrator to continue her fight on the front lines. With this, will you show your courage? Learn more about COVID vaccines at healthymke.com.
Perfect. Thank you, guys.
Thanks, Aziz. So, we can talk about these experiences all day long, but there's never a better source than individuals from our community. And so we've invited Laura Manriquez to join us and to share her own experience around vaccine, why she chose to get the vaccine, and what her experience has been through this process. Laura?
Good afternoon, everyone, and thank you for having me here today. It's an honor, as always, to serve. I was truly hesitant in the beginning to get my vaccines because as a traumatic brain injury survivor, along with looking at social media and the concerns of the different dialogue that was being given from the Tuskegee situations that occurred, as well as other individuals looking at their health situations, wondering if it would make them sicker. And the second reason that I had concerns was because of the first reason. Everything that I was reading and dialogue having with other individuals, I didn't want to get sick again. I had already felt horrible from having been infected with COVID, not once, but twice. And it felt like a truck had been just like literally driving over my body. I was in the bed, no matter what position I turned into, it was horrible. The pain and all the symptoms, I felt like I was going to die. And I didn't want to go through that again. So then I decided, because I am a UWM student as well as a McNair scholar researcher, I decided I needed to do what I knew best. And that was to do my due diligence and research scholarly journals and also looking at reputable sources that were giving out this information. That's what convinced me. I realized it was in the best interest of not just myself, but our communities to get the vaccine, and of utmost importance to protect not only my grandchildren, but our grandchildren in the community, because their lives are in our hands and there is no vaccine for them. And the least we can do as responsible adults is, of course, for ourselves, but how are we going to protect the children? If not us, then who? And so out of being a person, out of love as a mother, a grandmother, a nurse, and lifelong community advocate, I had to be involved in the well-being of others. And so it's an honor to serve on this campaign. And having local community is important to know about this because it's about trust. People trust individuals they know and feel connected to. So what better way than this campaign bringing real faces, real voices, real concerns to the forefront? And, it's almost like the domino effect. Let's keep it going. But you know what? We should have been doing this a long time ago. And so better late than never, but we got to keep it going. So thank you.
Laura, thank you so much. And so again, Laura has been part of this production process and has been by my side over the past week or so, doing a couple of interviews and sharing her story. And our next step now is to amplify that in the community, but again, encourage individuals to share their stories beyond a campaign, truly just sharing their individual voices and their own experiences, and nothing's going to matter more. So just a couple of things that we found also in focus groups is it is just so important to speak from a place of empathy with individuals who might be hesitant about the vaccine, who are maybe looking for information, ensuring that we're speaking from a place of empathy and not judgment, but a place of respect. Sharing facts that are simple, that are straightforward. There is so much out there in our communities that bringing facts that are understandable and that are just very simple and don't talk down to individuals is so critical. And then reminding people of those moments that are missed. Laura just mentioned, her grandkids and how important they are to her in her thought process. What we found through the data is that individuals, more than 73% of 2,000 individuals surveyed, said that they miss time with friends and family. That's a motivator. Others said they miss times going to restaurants, going to venues, going to shopping. And that was about 72% of that same survey said we're missing that. Others said they miss going to their faith-based congregations. And so those are huge motivations as well for individuals. So what I want to leave you with is let's recognize that this is a personal choice. We want for this to be an informed choice. We want to be sure that we're honoring people throughout every step of this process. And we hope that you'll share everything that we've been working on. Thank you.
Thank you, Mara, Laura, and Aziz for joining us today. Now we'll move into the media portion of our briefing. Our first question comes from Kent Wainscott with WISN 12, and this is for Mayor Barrett. He's wondering, If too few people are traveling downtown to the Wisconsin Center, is the health department taking steps to get more vaccine doses into neighborhoods, perhaps through mobile clinics?
Well, the City of Milwaukee Health Department is certainly proactive in its efforts to reach people where they are. We clearly have our centers, and for example, the Wisconsin Center has the capacity to do 4,000 shots a day. Right now, we're doing about 2,000 shots a day. So there's a lot of capacity there. But we recognize that we have to take the shots to where people are. And that's why we've been working with numerous church groups and churches themselves. We've been working with community groups. We've been had mobile sites go to public housing locations. We brought mobile sites to homeless shelters and other shelters for families who have been displaced. And we're working now to launch a home visitation program as well. So again, as Dr. Weston said early in this conversation, those individuals who really were excited about getting the shots, they've gotten it now. Now we're trying to work with that large group in the middle that is open to receiving the shots, but might face barriers, might face workforce barriers or childcare barriers, or they're sort of on the fence. And so we think the most prudent way for us to act and the most effective way for us to act is literally to bring the shots into as many neighborhoods as we can. So that's exactly what the health department is doing.
Thank you, Mayor. Our next question is from Me Wisconsin. Alejandro asks, this week, the Wisconsin Department of Health Services presented information on children's mental health and showed how Wisconsin is among 5 states that report cases of self-harm. Could you provide us some data on suicide, depression, or anxiety in our communities in Milwaukee in children and adults?
Sure. So we've certainly seen and talked about mental health challenges in Milwaukee County that are at higher levels than in past years. So looking at our EMS data in particular, we've seen since the beginning of the pandemic significant increases in 911 calls for mental health concerns, for suicide attempts, as well as for overdoses. And in 2020, the medical examiner saw 126 suicide deaths in Milwaukee County. That's the second highest number of suicide deaths in nearly 20 years of data. So we know that COVID has effects far beyond the disease in those who are infected by the virus. And this data demonstrates the continued need for community support resources, but also the need to see our way out of this pandemic as quickly as possible, and that's through vaccination.
I'll ask our second question from Me Wisconsin, which is for Mara. In the Latino community, there's a latent fear to get vaccinated against COVID-19 because many residents do not have the money to pay for hospitalizations in case of having or developing effects after being vaccinated. Are there any plans to address these fears in our communities?
Yeah, thank you so much for that question. So I would actually ask Dr. Weston to answer any question about the actual risk. There's a perceived risk and then the actual risk. I will address the question about what we're doing about communicating with individuals. And so we've been meeting with the Milwaukee Latin Health Coalition and with 16th Street and UCC, Al Castro, several others too. And then many of the groups that were funded through the DHS opportunity to mobilize individuals in the community. And what we have found and what we will continue to do is to ensure that there are direct one-on-one conversations with people to address those fears and really bring facts and level set on facts with individuals. So Dr. Weston, can you address the medical part of the question?
Yeah, so I think this is a consideration of sort of balancing risks, and it's a lot of times hard in life to balance risks. What are the risks that when you get in your car, you're going to be in a car accident? When you walk out the door, something bad is going to happen to you. It's important to understand the risk of a side effect from the vaccine is there. The most common side effect is a sore arm. Most people I've talked to, including myself, had a sore arm after getting the vaccine. A much less common side effect after getting the vaccine, but it still happens, are these kind of flu-like symptoms. You hear of people who felt somewhat ill. They were laid up for a day or a few hours. It usually lasts about 24 hours, sometimes up to 36 hours. And then it just goes away. It's just gone and you feel fine. Those are more unlikely, but they happen. Any sort of side effect that puts somebody in a hospital after getting the vaccine, some sort of a severe allergic reaction, something like that, are exceedingly rare, exceedingly unlikely. And you take that risk anytime you put any new type of food in your mouth? Are you going to have an allergic reaction to it? Things like that. So the risk there is extremely low. What we do know is the risk of contracting COVID, the risk of getting sick and laid up, not for 24 hours, but as Ms. Manrique has talked about, being laid up for a prolonged period, feeling terrible, feeling sick, that's a much greater risk. Most of us, probably the vast majority of us, know somebody who got very sick. And a lot of us know somebody who got hospitalized or somebody who died from COVID. So when balancing the risks, it's not even comparable. The risk of getting severely ill from the vaccine is pretty close to zero. The risk of getting severely ill from COVID is very real.
Thank you. Oh, go ahead, Mara.
I just wanted to share that, one of our targeted strategies also is for employers to take a significant role in encouraging vaccination, but also providing the opportunity for individuals who are when they're getting their second dose, to give them a paid day off. We know that employers play a significant role in, or they build confidence with their employees around health and safety. And through the pandemic, that absolutely is true. The surveys are showing that. So encouraging employers to provide incentives for their employees to get to take the vaccine, and then to give them that space, as Dr. Weston said, after that second dose, to take that time off, paid time off, is just a very targeted strategy that we think is really important for our community.
Thank you both. Our next few questions are from Sharon Bajenda with CBS 58. I'll ask them one at a time. They are for Dr. Weston and Director Rausch. The first one is, are young adults fueling hospitalizations in our community? And are hospitalizations in kids in our area increasing or beginning to plateau?
So I can start here and talk kind of generally. We are gathering information about the specific age groups in our hospitalized population. When we look at national trends, though, we're certainly seeing younger populations being hospitalized. So nationally, when we look at the age ranges, more than 75% or more than 70% of those hospitalized now are less than 65. This is very different from what it's been like throughout the pandemic. And this is the highest number, the highest rate of hospitalization in that age group since the pandemic began. So certainly we're seeing younger people being hospitalized. And it seems to be not only because that older population is getting vaccinated, which is great and good news for the vaccine, but also because the new variant, specifically the B.1.1.7 variant, which is the dominant variant in the United States now, is more severe and is more contagious and is far more likely to land you in the hospital today than what you would be if you had gotten COVID 3, 4, 5 months ago.
The second question is, any updates on vaccines for kids and advice for parents of children who have comorbidities?
So the development of vaccinations for children continues. There's emergency use authorization applications going on now, specifically for the little bit of older children, 12 to 15-year-old age group. But studies are going on through the entire spectrum of children, from very, very young, 6 months old, all the way up to 16. And so I do think we'll see vaccination certainly for children. The most important thing is right now, whether you have healthy children or you have children with medical conditions, the best thing you can do to protect your children is to protect yourself and make sure you're not bringing the disease home to them. And that's through getting vaccinated.
And the final question from Sharon is, what would you say to parents who are hesitant to get their kids vaccinated once the EUA is reached with companies like Pfizer and Moderna?
I guess I'll take a stab at this one and jump on from where Dr. Weston left off. Right now, since only 16 and 17-year-olds can be vaccinated, the most important thing you can do, I'll echo what Dr. Weston mentioned moments ago, is to get yourself vaccinated and vaccinate other adults that child may be around. Certainly, we anticipate and have seen that Pfizer is moving forward with the request for EUA. I would expect Moderna and other manufacturers to do the same in the coming weeks. And I think the message that we would give, and I would love if Mara has some feedback here too, but I think we're going to give the same message. Vaccination is important. Early in the pandemic, it seemed that the disease really impacted older individuals who were more vulnerably and immune compromised. Now with variants, as we have mentioned previously on this briefing, we are seeing more disease and more significant disease in younger populations. And certainly children with school and other activities and sports, they certainly have interactions that put them at risk. So I would certainly encourage vaccination for all eligible when the vaccine is approved and it is determined to be authorized for that age group. Mara, anything to add?
Well, so in surveys, what we found is that another motivator is protecting others. And so, as you know, we think about individuals who may not be making the choice to get vaccinated for themselves. Often, when we mention that getting vaccinated for those around you is important, it resonates differently. And so, I mean, I think, thinking about across the population, of course, is critical, but also just thinking about that motivating factor for individuals to encourage a mother or a parent to to have their child vaccinated or to get vaccinated for their parent, et cetera. So I think that's just another message that I want to make sure that we're all keeping within our mind as we're talking with people.
Excellent. The next question is from Courtney Sisk with WISN 12. She says, and I guess it's for the mayor. Since allowing walk-in vaccines at the Wisconsin Center, have there been an increase in people showing up? And are you seeing more walk-ins than appointments?
Well, we are seeing a lot of walk-ins, and that's good news. The walk-in volume clearly is up. But I want to stress this again. We have the capacity at the Wisconsin Center to do 4,000 vaccines a day. We're currently doing about 2,000. And so that number is down. I want people to be vaccinated, so I want them to know that this is a very, very good option for them to get a shot.
The next question is for you, Mayor Barrett, and it's from Brittany Lewis with CBS 58. She says, there were widespread bus route cancellations at several MPS schools. Are you concerned about the preparedness of the district, and are you aware of the efforts to fix the issue for families that need transportation for school?
Well, here it is. It's April 15th, and yesterday for all the kids essentially that attended Milwaukee Public Schools, it was like the day after Labor Day. It was like the first day of school. And it's not unusual. It's unfortunate, but it's not unusual that at the beginning of the school year, you're going to have busing issues. My experience has been that the Milwaukee Public Schools is very, very proactive in attending to those issues. They know it has to be resolved, and I'm confident they'll work out all those busing issues.
Thank you, Mayor. Our next question is from Stephanie Haynes with TMJ4 for our health experts. What are your thoughts on Pfizer's CEO saying a third booster shot is likely? Do you anticipate that will impact your planning for vaccine sites? And do you fear this news will contribute to more vaccine hesitancy?
So we've continued to see good news on the duration of immunity from the vaccine. Initially, people had been studied for about 3 months since getting the vaccine, and it showed that it was effective. So then we had kind of a 3-month time period. Now people have been 6 months out from getting the vaccine, and it still remains incredibly effective, even 6 months out. Now we know that can't last forever. At some point with any vaccine, with any immunity, that immunity starts to wane. And so certainly at some point, there'll need to be a booster shot. We see with vaccines like tetanus, you need a booster shot every 5 to 10 years. With something like the flu, we do a booster shot each year. And we put a little bit of different variants in there because influenza, like COVID, changes a little bit over time. And so absolutely, at some point, there'll need to be a booster. This is not a vaccine that is anticipated to last for your entire life and protect you from COVID forever. But I don't think it should by any means draw hesitancy. It's just the same as any other vaccine we get. At some point, you will probably need a booster.
Thank you, Dr. Weston. Our next question is from Sari Lesk with the Milwaukee Business Journal, and perhaps Mayor Barrett, you're able to comment on this one. She says, a Milwaukee restaurant owner interviewed on Fox News was critical on the city's restrictions and gating criteria, saying the bar of an 80% adult vaccination rate to get to phase 7 is unreasonable given the current rate. He seemed to imply that standard would keep city restaurants at limited capacity, even if a safety plan for a long time to come, while much of the rest of the state opens. Is his assessment correct? Is it fair, essentially, when you take into account vaccine hesitancy?
Well, one of the things that I'm very, very proud of is that through the 13 months of this pandemic, we have made every single decision based on science. And we are going to continue to do that. And we are going to continue to listen to CDC. We're going to continue to listen to the federal experts and the state health experts, so that we are acting not according to politics, but according to healthcare. And so I'm confident that we will be able to address these concerns. Whether we get to 80% or not, I don't know the answer to that question. Do I think that the orders are fair? I think the orders are very, very fair. And we really haven't gotten a lot of criticism. I think there are some individuals who, for political or philosophical reasons, want to be critical of any government involvement in this. But I think what we have seen again over the last year is by having a proactive, responsible, healthcare-based decision-making process, we have been effective in trying to fight this pandemic. And we're going to continue to do that.
I'm not sure if there's anything to add. Her follow-up is, how much weight will the vaccination rate carry in deciding which phase to follow if the other metrics are in phase 7 territory?
Again, what we'll do is we'll be in consultation with officials at the local level, the state level, and the federal level. And again, I ask people to recognize that we're trying to get through what continue to be some pretty rough rapids. But I think if people understand that we're trying to make the right decisions for the right reasons, I think they're far more understanding.
Our next question is from Taryn Powell with WUWM. It is, are officials seeing more hesitancy with the latest Johnson & Johnson news, or might it be too early to tell?
I wouldn't be surprised if we see some reluctance, but I'm hoping it's temporary. I think any news, quote, bad news, is going to fuel suspicion. But as Dr. Weston and Darren and others have said, the system is actually working the way it's supposed to work. And what I mean by that is when there are issues that are identified, what's happened is the federal government and the state government and local health departments have taken actions to address those issues. And I think that should give people some reassurance. But nobody likes to see a setback at all. At least I certainly don't like to see a setback.
Yeah, I would agree with all that. I think it's too early to tell definitively, but certainly something like this will lead to some hesitancy. I think once we learn more about the specifics of this potential adverse event, whether it's related to the vaccine, whether it's just related to how often something like this occurs in the population, we'll have a lot more information to share and can hopefully overcome any added hesitancy that it may create.
The final question I'm seeing is from Kent Wainscott with WISN 12. He's asking Mayor Barrett, if the vaccination numbers don't increase at the Wisconsin Center, do you have any concern that FEMA might end or scale back its pilot program there?
Well, we've had a very good, positive working relationship with FEMA, and I think that they share our concern that we want to see more people get vaccinated. Obviously, they're going to use their resources where they are most effective. We still believe that is a very, very effective site with 2,000 shots a day. That's a significant number of people. We just want to do more. We want to do a better job. We want more people to get the shots in their arm. And so we're going to continue to do everything we can, not only at that site, but we get additional shots from them that we're able to use in the community. And we'll be utilizing those as proactively as we can as well. So they have to do what's right. They have limited resources, but I think that they understand that this is a community that has really, really tried to tackle this pandemic in a very serious way.
Thank you, Mayor. Sari Lusk with the Milwaukee Business Journal is wondering, is there any risk of doses having to be disposed of because people are not taking the open slots?
I can speak for our site, and I think this is similar for sites across the county. We've been extremely careful not to have any vaccine wastage. At our Milwaukee site, we've had 0 doses wasted. Many other sites are in the same boat or have had extremely low levels of waste, and we plan to continue to do that regardless of how full our clinics are by managing, prioritizing appointment scheduling.
Yeah, absolutely. I'd echo everything that Dr. Weston said. Here in the Greenfield Health Department, we take that very seriously as well. We're all, I would say, as community vaccinators, are tracking those expiration dates very closely. And except for Pfizer, Moderna and Johnson & Johnson vaccine can be refrigerated for several weeks. And so in my case this week, we needed to reallocate some doses where we were getting close to the expiration date coming in the next couple of weeks. We reached out to the state Department of Health Services and they were able to find a home for those doses so that they could be used in communities that were really looking for additional vaccines. So there's ways for us as community vaccinators to work with the state to get doses into the hands of other community vaccinators that need them elsewhere in the region or the state.
Thank you both. Those are all the questions I'm seeing in the chat for today. Thank you to our guests for joining us and sharing your story and sharing details about the campaign. That is so important to have you here today. And that will conclude our briefing. Have a good